Thank you so much. So welcome everybody to today's session that we are hosting here on the unceded territories of the Coast Salish people. This is an invitation to participate in the conversation about cultivating health promoting universities remotely and during a pandemic. This is a joint event between the SFU Faculty of Health Science and SFU Health Promotion Team. And if you're on social media and you'd like, we recommend that you use the hashtag campus if you want to participate in any of the conversations over social media. First of all, my name is Paula Armas, and I am a teaching fellow and lecturer with the Faculty of Health Science here at Simon Fraser University. I am a forced migrant, a woman of color. My pronouns are she, hers, and her. And I am very grateful to live here, live, work, and play on the unceded and traditional territories of the Musqueam, the Tsleil-Waututh, Coquitlam, Kwantlen, Musqueam, Squamish, and other Coast Salish people. Today, we are going to be together for about an hour and a half. And this is what the agenda that we've put together is. We're going to be doing, first of all, a introduction. We're going to be doing some background on what are health promoting campuses, as well as understanding what a whole systems approach means in the campus environment, and particularly how this relates in pandemic mode that we are all in, whether we like it or not. And then I have the pleasure of turning it over to our panelists. And at the end of the session, we will open it up for a question and answer period that we can all learn from each other and have a dialogue for the last 20 minutes of the session approximately. So that is a little me, and I just wanted to thank Yuna Chen, who is helping me moderate, who's going to be helping with the chat function, letting people in, and also here. But she's also been instrumental in putting all of this together along with her team. Kudos to Melissa and all of those who helped out from the health promotion put this webinar together for us. And I just wanted to turn it over just quickly to Yuna so that she can share a little bit of housekeeping tips for us in this online environment.
Sure, thanks, Paula. Hi, everyone. I just wanted to remind everyone to, I guess, mute ourselves when we are everyone's doing it. It's awesome. You're welcome to leave your video on or off, depending on what you prefer. And then there's different ways to interact as well. You're welcome to unmute yourselves when it's time to ask a question, to speak, and you're also welcome to chat in the, or to type a question in the chat box, and we can voice it to the bigger group later on. And a reminder that this is a respectful and inclusive place. We're all here to learn from each other, and I'm excited to hear more about what everyone has to say today.
Thank you so much. So on that note, just to note that we are going to be holding the questions until the end of the session, just to make sure we get through. There's quite a lot of content that we wanted to get through, and also examples, really trying to bring some of the learnings that we've experienced from our own perspectives. And just something that I just wanted to follow up on what Yuna was saying is that I wanted to acknowledge that the work that we're going to be talking about here is really built upon decades of work that have been going on at SFU, at UBC, and many other universities and colleges in Canada and around the world. So I wanted to give a shout out to all the people that have been a part of this work. Some of the people, unfortunately, could not be here today with us, but just to say that we're building on that and also trying to use this as an opportunity to have a conversation about how do we contextualize this learning within the pandemic environment that we are living. So as a reminder, when we put out the invitation, we had thought about the purpose of this particular webinar, and we thought that it would be a great opportunity especially for folks that aren't familiar to what a healthy universities approach looks like. And we're going to be giving some examples concretely from SFU and UBC, but we are also wanting to speak to the whole issue around how do we adopt a whole systems approach within a campus setting, particularly now with this remote and online learning environment that we are facing, and many of us are grappling with that is starting in September in just a few days now. But also we really wanted this to be an opportunity to contribute to creating a culture for health promoting universities within this context. And so learning from you and from all of us that are involved in this and that are passionate about this is really important. And that's why we'd like to leave ample time at the end to be able to hear from the many participants that have joined us. And we're really grateful that you could make it today. And on that note, in terms of past acknowledgements, I wanted to say that the theoretical foundations of the health promoting universities movement is decades old, and I wanted to just again acknowledge that the field of health promotion, which is where a lot of this work stems from, really originated, back in the 80s, and many argue that even earlier, because it really is a field that is completely interdisciplinary and growing out of many other fields, including psychology, sociology, anthropology, ecology, etc. Now, the Ottawa Charter for Health Promotion is something that well, we could do a whole webinar series on the Ottawa Charter. So I just wanted to say the importance of this document was really around making sure that everybody that is looking at the concept of health is looking at it through a very systems-oriented and holistic concept. So we're not just talking about disease or the absence of disease, but when we're talking about health from the perspective of the Ottawa Charter, we're really talking about all of the different factors that are interplaying as we are creating conditions for health. So what's very important about this is what we often talk about as a settings approach, which is also very much multidisciplinary and holistic, and really is setting the stage for us to think about the way that we create health is through creating a healthy environment, whether it's a social environment, it's a physical environment, but really where we live, work, play, study. That is the area where we actually create health. Health is actually not created in the medical system. It's not created in what we consider the healthcare system, because really that system has been set up to treat people, as you know, of course, who are already ill, or in some cases, of course, to think about how do we prevent disease. But health promotion is really kind of taking a step back and thinking about how do we create those supportive environments? How do we strengthen community action and build the policies that will actually keep our communities well? So it's a different orientation than thinking of it from a medical or a clinical model. So I wanted to just speak to that, because I think that that's kind of an important foundation of where this work has been built. And also that this is not only thought about in terms of like the different systems that are interacting and influencing each other, but also thinking about it from an ecological perspective that stems from looking at the issues that we're facing through different levels, whether it's intrapersonal, so impacting the individual, to organizational, community, and even at the policy level. So it's it really is broad in all of its perspectives. So the reason why we organized this webinar today was because back in 2017, a group of us at SFU had the opportunity to contribute to chapter in health promotion in Canada, which is, excuse me, a textbook that we use in Canada in health promotion undergraduate and graduate programs. And what we realized is that some of the information that we had gathered for that chapter is obviously out of date now in 2020, but we started to think about how does this work around health promoting universities really apply now in the area of COVID. I spent a lot of time over the last couple of weeks online and on Twitter and looking for resources, and there is so much out there in terms of how we're coping with this new environment, how we're supporting students, how we are transitioning, and all the different policies and resources that are at interplay right now. But I had yet to see conversations about how do we apply a whole university or a whole campus perspective to this issue. And so that's what we want to talk about today. One of the things that's really important in when we were designing that chapter is that we were building from a lot of work that was being done already at SFU through the health promotion team. One of the pieces of work was a study that really looked at what were the individual benefits of enhancing well-being within a campus environment. And it's not surprising to you, I'm sure, that there are a lot of benefits in terms of the decreasing stress, isolation, anxiety, hopelessness, and depression. And I say not just for students, but if we actually are applying a health promoting universities concept, those apply also for staff and faculty. And then the other piece is that there are many benefits where we would see an increase in resilience, persistence, connection, sense of community that really support a thriving environment in the higher educational settings. So there's a lot of literature. We are happy to provide more background if anybody's interested in that, around why it's so important to be thinking about promoting well-being. Again, not just in terms of the student learning perspective, but also in terms of like creating a culture that actually supports well-being at all levels of the institutions. And this leads me to a really important document that both UBC and SFU had a really critical role in the development of what's called the Okanagan Charter, an international charter for health promoting universities and colleges. This was an international meeting that was held here in, as you can see, in the Okanagan in 2015. There was a lot of planning and a lot of people were involved, including many people that are on the call today, in really shaping this and what it was really standing for in terms of promoting a whole systems approach in higher education to promoting health and well-being. And I just want to highlight two things that I think are really important. This was a call that was put out, 45 countries participated, and there was a lot of dialogue and collaboration generated in terms of putting together what became this document. But the important piece that I'd like to stress here is that the calls for action that came out of the Okanagan Charter were really around embedding health and well-being into all aspects of campus culture across administration, operations, and academic mandates, and also to lead health promotion action and collaboration locally and globally. So ensuring that when we're talking about a campus community, it's also about the partners and the larger community that we're embedded in, but also working with in collaboration. So one of the things that you might be asking yourself, okay, what does a whole campus approach mean? And as I was preparing this, I was really fortunate to come across some work of some of the thought leaders in this field from the UK that did a recently published a report where they interviewed key stakeholders from across institutions around the world. And they really described well what I thought were some of the key domains that we find, or key characteristics that we see in a whole campus approach. And so really one of them is around developing a supportive ethos, organizational culture and learning, working and living environments. And for us, I think that means, thinking about how do we identify the gaps that we see in our institutions, but then also really important, harness all the good work and all of the efforts that are being carried out by different stakeholders across the environments. The other piece is around embedding health into all of the university's business, joining up with all the activities and areas of work. And I think that that is important to consider how we are including health including health as a key consideration into all policies and all decision making at the university and college level. So it means everything from how we're designing buildings to how we're thinking about our active transportation modes, how we're thinking about designing the academic calendar, how we're thinking about our pedagogical practices. And the third one is focusing on the whole population, promoting health and well-being of students, faculty, staff, and the broader community. As I mentioned earlier, it's also, about tapping in beyond the classroom and looking for those opportunities to collaborate in real life learning and civic engagement that, both of the universities that are being featured here are very well known for. And I think that one of the important things about this point is really to take the time in terms of identifying and appreciating the different needs and also the different priorities of all the subpopulations that we have here on campus. So it means then we have to also balance the decision making in terms of what the leadership is interested in, but also thinking of ways of we co-design and use participatory approaches in order to be able to engage folks from across the campus. So what we have found going back to 2017 to the chapter that we were involved in is that there are quite a lot of challenges in applying this type of thinking because it really asks us to shift. It's like a paradigm shift in terms of thinking about healthy campuses, not from the perspective of perhaps at the individual or clinical level in terms of supports in place, but really thinking about how are we designing the social, organizational, and physical environments to promote health and well-being. And one of the challenges that we run into in terms of this shift in the way we think is that because our institutions are really focused and mandated and funded to focus on students, there's often gaps. At least we found this in 2017. I think that we're making quite a lot of progress, but in the past, we've seen there's quite a lot of gaps in terms of how we're incorporating staff and faculty health and well-being also as priorities in order to really take this whole campus approach. And the other piece that's really challenging and continues to be a challenge is measurement and monitoring. So in order to build the evidence base to be able to do this work takes time. It is something that not only takes resources and times, but it's also operating within a very complex environment where there are many different actors and stakeholders with different interests, different ways of viewing the world, different priorities. And so to come together and figure out how to find the appropriate ways of measuring and monitoring this work is really challenging. And this is why, again, advocating for a whole campus approach is something that really needs to happen across the board in all different departments, whether it's facilities or it's a sustainability office or it's people that are thinking about supply and of food services. Really, we need to be advocating at all of those different levels in order to be able to make the case. There are also many enablers that we have found that actually support this kind of approach. And part of that is thinking that we need what I like to call the nutcracker effect. And I've found that term in the literature was really, it's having the grassroots support, but also the leadership support. So ensuring that students, staff, and faculty are engaged and advocating for this is just as important as the decisions that are made, at the VP, president, management level in terms of bringing the resources and supports to make this happen. Many campuses here in Canada, there is a large network of colleges and universities that are working towards these goals, and many use participatory approaches to ensure that we're bringing in diverse voices so that all different perspectives are being heard. There's a lot of work happening around building the evidence base, and there are, I think, quite a few researchers actually on this call right now that are working on that. And then there's also an incredible amount of work on identifying champions across campus, which are really critical in making sure that these conditions that promote well-being are really championed across the different departments and areas that we work in on campus. So I wanted to move and show you a little bit about one of the frameworks that we use here at SFU. This is an example of how we can think about using a whole systems approach or a whole campus approach, is thinking about where are different areas where we can actually intervene, implement change, and then, as I was mentioning earlier, measure and monitor the progress. And so what I like a lot about this is that this framework really allows you to see very practically where the supports are needed. And because often when I've been asked, well, what does a healthy campus mean really for me as a faculty member, for me as a student? And a lot of times we think at the individual level and think about, well, what are the supports that I need, for example, to be mentally well and cope now during a time of the pandemic. And that's absolutely critical. And there are people that are really working hard on that issue across the universities and colleges, but it's not enough. We need to be thinking about how we're implementing these health promoting policies in the learning and working environments. So that's like, how are teams collaborating together? What kind of leadership works and what kind of doesn't work in terms of moving these policies forward. There's also a lot of work that needs to happen in terms of creating social connection and ensuring that we're engaging our communities both on campus and off campus. There's a ton of work happening in terms of how we're building our physical spaces to promote health and well-being. I'll talk a little bit more about that in a couple of slides. There is also an incredible need, and I would say now even more so in the times of COVID, around ensuring that our policies and processes are promoting health and well-being, and we'll talk a little bit about that coming up as well. So this just gives you a little bit of a landscape of an approach that SFU has taken, and other universities have taken different approaches that are really contextualized to their own setting, because that's one of the things that's very important about healthy campus environment, is that we need to be taking into consideration the context, the resources, the stakeholders, and the different levels of power that are all interplaying and interacting on campus, because it's not one size fits all. There isn't one model that's going to work for everybody, and as you can imagine, every setting is quite different. But there are things that we're learning and that we're sharing along the way. One of them is this model related to how do we create well-being in learning environments. The SFU Health Promotion team has been working for quite a number of years with different partners at the university, faculty level, department level, and a lot of work has been happening with the Center for Educational Excellence on ensuring that we're working towards well-being in all of these different areas. So whether it's building inclusion or social connection or opportunities for civic engagement, real life learning, positive classroom cultures. All these aspects are really important and demand not only our attention, but actually to find, as I said earlier, the champions that are really going to be able to support the implementation and continue to advocate for this work. One of the areas that we focused when we were writing the chapter back in 2017 was the area around well-being through physical spaces at SFU. And there was a lot of literature at that time, and this is something that's continued to increase in terms of how, we can think about the use of natural light, natural landscapes, indoor plants, all these things that actually support us. And I definitely know from my own personal experience, when I've worked in an office space that had no windows, it really did impact my mood quite quickly. And I would have to find ways of making sure that I'm outside of that space in order to be able to continue doing my work. So it has an impact on us almost immediately. Now, there is a lot of research, I would say, more than 30 years of research from medical and environmental psychology fields around, how the built environment is connected to the health outcomes. And I think that one of the things that's really important is that all of this now is shifting in times of COVID, right? And so the next question I have is really something that I'm going to dive into for the last few minutes of my talk, is really, so what now? We know the main principles of creating a healthy campus through a whole systems approach. But what's happening now in the times of COVID is something obviously unprecedented and something that we are totally not prepared for and grappling with in terms of how we move forward. And so what I will do is in a few minutes, I'm going to pass it over to the panelists, and everybody will be sharing some of their own perspectives on this issue coming from their own lens and the areas that they work in. But because I am a teaching fellow and a lecturer, I thought that I would share a little bit in terms of what I've seen in terms of the teaching space. I'm on Twitter a lot because I find really interesting things there. And one of the things I was like thinking, I was just testing the temperature to see what is going on right now in relation to the fall semester and what people are posting about what it's going to be like to teach in this new environment. And I found it really, really interesting that two things came up for me that I think for me are sort of like the ways forward in the way that I'm going to approach this. And one of them is to think about designing the teaching methodologies and the ways that I work with people through, principles of care and principles of equity. And it was very interesting for me to see that many of my colleagues from around all different kinds of colleges and universities, both here and in the States, we're sharing a lot of perspectives in terms of ensuring that we are empathetic, that we're compassionate with what students are facing. Many of them have additional stressors because of their own social and personal conditions. And what was interesting for me is that all of this was in relation to how students are coping and how do we support students. And I just wanted to kind of flag that for me, this is also about how we support our faculty and our staff as well, because there are many challenges that we are facing that we don't necessarily get to see or hear about, but it really is important to take a step back and think about, how does the culture that we're all creating on campus contribute to well-being or actually hamper our efforts. One of the things that I came across was this document around designing for care, and it really spoke to me because it made me ask a lot of questions of myself in terms of How are we building flexibility and trust, which is so important during a crisis situation? How are we creating a community and a sense of belonging now that we're working in remote and online environments? How are we acknowledging trauma that many members of our community have and will be experiencing? And how are we meeting the different learning and also meeting needs across stakeholders, students, faculty, and staff across campus? And finally, how are we designing for collaboration with local communities, both our disciplinary communities, but also the broader communities that we're engaging with? And I don't have the answers to this. This is something that I'm starting to inquire about as September is getting closer. But I really loved thinking about it from the perspective of care and equity. I've been using a lot of equity-centered design approaches in my courses, and the same person that wrote that had this really interesting and I thought it was quite a beautiful quote that really spoke to me in terms of thinking about how we're designing for the ones who are the least privileged and the ones who are already struggling and facing exclusion in various different ways. And so how do we think about writing policies or academic plans or curriculum that actually addresses those needs, back to what I was mentioning earlier. So this is something that I'm going to be thinking about, and I'd love to hear your perspectives on that. As I said, we're going to be leaving the questions answer period for the last 20 minutes. But now I'm going to turn it over to our wonderful panelists to be able to share from their perspectives some of the things that they've been thinking about, or perhaps resources or strategies that they have been either involved in creating or thinking that might be something we would like to consider during the times of COVID. So my pleasure to introduce Una Chen, who's the Associate Director of Health Promotion SFU. And I've asked them, the panelists, for a few questions, and one of them is to tell us how their current work relates to the Healthy Campus approach, and also just to share some practical tips in terms of what we can do to better support people now during the time of the pandemic. So I'll turn it over to Una.
Awesome, thanks Paula. Hi everyone, my name is Una Chen. My pronouns are she, her. And I just want to acknowledge I had the great honor of working with Paula, Tara, and Crystal, Rosie, and Elisa on this work back as a practicum student. So I'm hoping to continue all their great work and to honor what they've been doing today in this role. And for, I guess, the 8 to 10 minutes we have today, I wanted to bring the perspective, a twofold perspective. One is what we're currently focusing on, and an update on what we're, I guess, doing in a more bigger picture settings-based approach. So I'll start with the latter. So in terms of the settings-based areas of action that Paula had highlighted, our team still participates in a policy working group as part of the Student Experience Initiative. And we are collaborating with the Mental Health Commission of Canada on implementing a standard for mental health and well-being for post-secondary students. And our physical spaces work, although we're not physically on campus, residents in housing, our great colleagues there, are thinking about their new residence building. How can we pick furniture that's comfortable for students and conducive to community well-being? And as well as how can we get WELL certification to let folks know that we have access to mental health supports on campus for their student staff and their full-time staff as well. And for the focus of this conversation and the past 6 months, as we've dealt with COVID-related transitions, our priority has been thinking about inclusivity and equity as a condition for well-being in the virtual learning environment. So when we talk about the learning environment, as Paula has mentioned on a high level, it is, I guess, about faculty, course design, the curriculum, the culture that they build, but also thinking about some of our student services colleagues and what programs are they developing so that students can build social connection outside of the virtual classroom. So in terms of how our work has been promoting health and well-being on campus during this time, we were acutely aware that students are undergoing a lot of challenges, as Paula has mentioned, but they may be in homes that aren't supportive of their identities, may not have access to reliable technology or a private study space. They might be coping with uncertainty and grief and trying to figure out some of the financial constraints that they may have had by losing a potential part-time job. So we knew that this pandemic was kind of exacerbating existing inequities. We also looked back on the research and we knew just from so many faculty champions that students excel in the learning when they feel safe and when they feel like they belong. And because now, I guess, instructors are their main contact or close connection to campus, we really wanted to focus on how can we create inclusive learning environments that let students bring their whole self forward so that they don't have to hide in order to fit in. And so with our colleagues at the Center for Educational Excellence, with Lihua Mack and Melissa LaFrance, my colleagues who are leading this great work, we quickly pivoted some of our well-being and learning environments content to focus on some best practices that instructors or faculty can implement in their virtual classrooms. We also co-hosted a webinar that had strategies for inclusivity in a remote learning environment and collated all that great knowledge into a document that Paula will share later on in the resource slide. And then I know that Sherry was on the call here. I saw her join us, so thank you. But with her great work and leadership, along with Lihua, they've been continuing to lead the teaching and learning development grant. So with, I guess, 9 faculty leads, there's certain well-being interventions that focus on those conditions in that diagram with the red circles, and to implement and to evaluate those interventions. And the faculty leads have been so flexible and great with providing that COVID-19 lens, with thinking about how student learning and well-being has drastically shifted with this pandemic. And then as looking forward to our future work and kind of sustaining some of these practices, we're looking towards highlighting some, I guess, faculty champions or their stories across all of SFU to see what practices they're doing so that it can hopefully inspire or let other folks know that there's a plethora of ideas, and we're trying our best to kind of share those with the broader campus community. And then the last piece here, I want to touch about more student-facing content that we had shifted all our workshops on wellness and resilience to a virtual format. And with our collaboration with the Faculty of Applied Sciences, being able to, I guess, go right into those core courses and speak about wellness and resilience as a priority for academic success with first-year engineering and computer science students. And Lihua had developed this wonderful digital flourishing guide for students to have a mindful approach to technology as well. So incorporating practices like looking away at the computer screen 20 minutes for 20 seconds for 20 meters, which you're welcome to do now. And also thinking about our ergonomics and our workspace. How can we use, household items to make our workspace at home? So we're working with our marketing team to kind of get that content out directly to students using social media and other, I guess, student directed content. And then the last piece here was that we couldn't think about inclusivity without also thinking about anti-racism. And our team here, we're trying to, I guess, incorporate that activism into our work, looking deeper into the literature on how we can better support Black students, Indigenous students, and students of color. And also in working with Martin, our director, and the student union to determine some of the appropriate next steps. So taking guidance from folks who have joined the Black, Indigenous, People of Color Committee and speaking to them on what their ideas of what we can do next to better serve them. And then we were asked to give one example, and I think here I'm kind of combining twofold, but maybe having the flexibility to meet students where they're at, and what that is, kind of addressing the elephant in the room, but also trying to relieve pressure when possible. So offering some asynchronous options when possible, keeping in mind students in different time zones, students who have additional responsibilities as a parent or a caregiver, as well as some of the pressures that can come along with synchronous technologies. So yeah, just keeping in mind that student-centered approach. And as I'm sure many of you folks are also having a lot to deal with, but having, I guess, that sense of empathy that Paula had mentioned can go a long way for students feeling cared for and having that capacity or bandwidth to absorb the content that you're giving to them. So that's, I guess, our work in a nutshell. And thanks for the time to talk about what we're up to.
Thank you so much, Una, and we look forward to hearing more and learning about your resources that you have provided, some links that we'll be sharing with you all at the end. So we're at the halfway point right now, and because this is about health promoting universities and colleges, I'd like everybody just, if you want to take a minute to stretch, if you need to go away and come back in a minute or so, I'll just pause for a minute, and then everybody can do whatever they want to make themselves feel better, because we do spend a lot of time online and a lot of time sitting, which is not the most health promoting thing to do. So I invite you all to do that, and we'll start again in a minute. Okay, isn't it incredible how much a minute means to us when we're in these situations? I'm waiting for Angelica to, there she is, to come back. When some of my classes, I've been working with a couple of TAs who've like done little meditation breaks in the middle of the classes, and hoping to incorporate some of that into my online classes now. But somebody who can really speak to the experience from a student's lens is Angelica Yi, who I've had the pleasure of learning with you for the last couple of years. She's a recent graduate, and I've asked her to join so she can bring that student perspective to this conversation. So over to you, Angelica.
Thank you so much, Paula. So hi, everyone. My name is Angelica, and first I would like to acknowledge that I am a settler of color here in Canada and that my preferred pronouns are she and her. And as Paula mentioned, I was a Master of Public Health student in the Faculty of Health Sciences at SFU. I recently graduated in June 2020, so I had a COVID-19 convocation at home. And my research and studies focused primarily on environmental and occupational health. And I also completed my Bachelor of Science in Health Science at SFU. So I've been there for many years. And I actually was also a previous employee in human resources as well. And there are a couple of things that Paula had asked us to talk about today that Una had already mentioned. So one of the first things I'll address is how my work connects to the Healthy Campus Systems approach, particularly in promoting health and well-being and wellness on a healthy campus. And one of my connections to a systems approach in promoting health and well-being is through research, which is something Paula mentioned as well. And I'm actually honored to be one of the many students and now alumni that had the chance to work with Paula in conducting research in this field. And I think it's really important to recognize that although SFU, particularly Una's team at SFU, has implemented projects like well-being in learning environments and the Healthy Campus Initiative for years now, this is still a relatively new field in terms of application And we see that in research where this field is not very well researched. And this is why innovation through research and application is a critical area for promoting health and well-being, of which Paula is a leading scholar and practitioner. And another way my work connects with the systems approach on campus was through my role as a health and safety representative at SFU. And I was in that role for about 2 years, and it feeds into many of SFU's healthy campus community areas for action. And I'm really glad that Paula mentioned that earlier in the slides as well. And some of the areas for action that I engaged with in that role was learning and working environments, physical spaces, that's a really important one, services and supports, and of course, policies and processes. And my specialty being in environmental and occupational health, which can be very technical at times. A lot of times we're focusing on physical environment and policies and processes. However, I'm also trained as a public health practitioner. So it is also my role to promote participatory engagement with university stakeholders to transform the campus into a safer and healthier proactive environment through safety plans, consultations, audits, and regulatory approaches. And as you can see, a lot of what I focus on, or choose to focus on rather, has a preventive approach. And that's what leads into the proactive approach as well. And one of the things that Paula asked us to talk about today as panelists is an example of what staff and instructors can do to address health and well-being challenges during a pandemic. So for example, now during COVID-19. And from my perspective as a recent graduate, I think one thing that staff and instructors can do to address concerns related to health and well-being during a pandemic is to embed open discussions with students and with each other within the curriculum and the campus culture as a whole as well. And it is important to remember that campus isn't just a workplace, a school, or a safe space, or a place to live. It is a microcosm of the society that is embedded within. And even in a remote or online learning environment, right? We are still engaging with each other, even though it's virtual. And I believe we can strengthen a culture that's rooted in empathy and engagement despite our physical distance by having staff and instructors, people in positions of privilege and respect with a lot of knowledge, address these challenges transparently and opening up our spaces to have these discussions about inequities and transformative approaches. And I think this is really important because we don't just leave our intersectionalities, our identities, or lived experiences at the door before we virtually or physically enter our shared campus environment. And the stresses and struggles that affect our mental, physical, and emotional health, which is something Paula mentioned earlier, shape how we interact and treat each other. So just because we no longer share physical spaces during a pandemic does not lessen the importance of supporting a health promoting culture among our peers and each other. And as a person of color and a recent graduate, I will always participate in a lifelong journey of allyship in support of my Black and Indigenous peers. And as a Chinese Canadian whose family has been in Canada for several generations, I've recognized the re-emerging violence and intensified microaggressions against Asian communities during COVID-19. And we must engage and talk about these difficult topics, particularly at an institutional level. And staff and instructors are our mentors. We look to them for help, we look to them for support. And the institutions should support them in turn in facilitating these safe spaces for participatory discussions. And to end off my time here as a panelist, I just want to say thank you to Paula for inviting me to introduce the student perspective. It's really an honor and I really appreciate it.
Thank you so much, Angelica. It was great to hear from you because you not just bring the student lens, but also your work experience and research in this area. So very much appreciated. Now we're going to be inviting Crystal Hutchinson, who we had the pleasure of working with at SFU, and now she's at UBC, making headways in different areas, but all connected to our work. So hand it over to Crystal.
Thanks so much, Paula. Hi, everyone. My name is Crystal Hutchinson, and my current role is, as Paula mentioned, Workplace Wellbeing Practices and Learning Consultant. It's a long title. I work within UBC Human Resources Health, Wellbeing, and Benefits team. And I also want to mention that I have 2 dogs at home and a toddler. So you may hear barking or screaming. I hope it's not too disruptive, but they are here in the background off in the other room. So I want to start off just by acknowledging my wonderful colleagues, the people I work with within UBC Human Resources, as part of the UBC Wellbeing Secretariat in Student Health Promotion and Education, UBC Teaching and Wellbeing COP, as well as the Wellbeing Strategic Support Team, which has representation from all across UBC. There's a lot of exciting, innovative work that's happening at UBC, and I'd love to share it all with you today, but what I'll be speaking to won't be representative of that. It's more of a snapshot. And really the perspective I'm bringing will be focused more on the workplace. It's focused on staff and faculty well-being, and this idea of creating workplaces within our universities that support well-being from an individual, interpersonal, and also structural or environmental perspective. So my current role at UBC, how it connects to the Healthy Campus Systems approach, it does so in a number of ways. Again, I'll only be highlighting a few, but first of all, I think it's important to note that we are fortunate at UBC to have leaders that do support this work. So, you know, in terms of advancing well-being for all and our commitment to the Okanagan Charter, I mean, those are our commitment to the Charter and advancing well-being are demonstrated in our university strategic plan. We also have a university-wide well-being strategic framework, and on the HR side of things, well-being is actually weaved into our strategic commitments as part of our Focus on People 2025 plan. So the reason why I mention this is just because really having this type of alignment strategically across our university has been very instrumental in moving this work forward as an institution, in forging partnerships, not only across HR, but across all of our faculties, departments, and units within the university. And I also want to acknowledge the years of grassroots driven efforts that took place at UBC before the charter was created. It definitely predates my time at UBC, and these efforts still continue locally within and across the university, and they really help to establish a strong foundation for health promotion work before any of these strategic pieces were in place. So in terms of the workplace health promotion perspective, a big focus for us historically, but as well as the past few years, but even more so now with our current situation, is around mental health and strengthening resilience. So more specifically enhancing mental health literacy among staff and faculty, particularly managers as well as leaders, because we know from the workplace literature that middle managers, supervisors, and those in leadership roles really play a key role, a very influential role in contributing to workplace culture, specifically creating a supportive and inclusive workplace. So we're currently working towards enhancing mental health literacy by embedding these educational pieces into all of our leadership trainings and learning opportunities that are provided through human resources. And in relation to the shift to working remotely, many of these trainings and learning opportunities already had an online component. So over the last few months, we've worked towards building out any remaining pieces to make sure that things are still accessible and flexible for folks in terms of hosting them on digital platforms. Another piece that I wanted to mention, and this is more focused on the practices and processes in the workplace and the impact that those can have on workplace culture. We're really drawing on the National Standard for Psychological Health and Safety in the Workplace for this work. So trying to educate teams and departments on the 13 factors that contribute to psychological health and safety, the roles that staff, faculty, managers, supervisors can really intentionally take on to contribute to those 13 factors. And we're drawing on these factors in our consulting efforts with faculties, departments, and units, but also infusing them into a number of our trainings and learning opportunities. And because our institution is so large and complex, with we've got many different work sites, we have 2 campuses, different unions, many different types of work going on. We do provide more tailored support and guidance to departments, units, and faculties who want to advance workplace well-being. And now with remote working and learning, these consultation efforts have become even more important. So a great example of this is a 2-year pilot project that we currently have with a faculty at UBC. So I think some promising practices related to this are that the dean is directly involved, as well as other leaders and champions in the faculty. The pilot is in partnership with our change and transition team in human resources. So a colleague of mine who's a change management consultant and I are working with a team of staff and faculty within the faculty over the course of 2 years to create an action plan, as well as to assess and evaluate impact of that plan once it's complete. And the end goal really being to enhance resilience, enhance people's capacity to navigate change and transition, and ultimately, of course, to contribute to a supportive working and learning environment. And then lastly, I want to mention some exciting work that UBC Human Resources has been involved in since 2017. And that's been utilizing a health equity impact assessment on internal processes and programs. So for those of you who might not be aware, a health equity impact assessment, or an HEIA, is a public health tool. It's essentially a structured, evidence-informed process that you undertake in order to identify unintended negative and positive health and equity impacts of a policy, of a process, of a project. And we're really thrilled to be able to say that we've completed 3 to date. And a lot of the recommendations put forward have been enacted, which is fantastic. We're currently working on administering a 4th, hopefully in the fall. And I really want to highlight this tool because it is a way forward in terms of taking action at a systems level. It involves building capacity for those involved, helping them to really understand what it means to embed a health and equity lens in decision-making and everyday choices really that we make in our work. It involves elevating voices and experiences of end users and those individuals that are most impacted by policies, processes, projects. It's also really valuable because the data that comes out of it really demonstrates this interplay between health and equity. And lastly, Paula had asked us to provide an example of what staff and faculty can do to address health and well-being challenges during the pandemic. And I'm happy that I feel like my response aligns with some of the others that were shared, but really it's related to self-compassion. I feel like most of us have been operating with this sense of urgency that's been sustained over several months now. And I think about this amazing trauma researcher named Dr. Bessel van der Kolk. And he's really labeled our current situation as a pre-traumatic state and saying that, you know, we've lost a lot of control over our external lives. And so I really feel that the first and most important thing we can do is to practice self-compassion, particularly if you're in a caregiving role. But in general, we need to remind ourselves that this is not business as usual, that we're trying to complete our best work and live our lives the best we can amidst a global pandemic. And so I really think it's an opportunity for us to try our best to slow down and ask ourselves how we can foster a culture of caring and compassion in our workplaces, but most importantly, I think in the way that we approach ourselves, because I feel that that internal work starts first. And then lastly, I just want to encourage people to explore opportunities to really embed an equity lens in the work that that you're doing, just because COVID-19 has had such a huge impact, particularly as it relates to inequity, and it's exacerbating inequities and it's surfacing a lot of wicked problems. And I mean, until we truly address some of these structural inequities, it's going to continue to be a bit of an uphill battle to achieve well-being for individuals and communities. And, you know, you're thinking about a social determinants perspective, social determinants of health perspective, and you know, that really truly acknowledges that equity underpins health, and social justice and human rights, how foundational they are and how necessary they are to be well. And so I think it's a great opportunity to start exploring ways that we can do better as it relates to equity work. And that's it for me.
Thank you so much, Crystal. You did an amazing job of, in a very few minutes to share, you know, both those technical aspects, but also back down to the human-centered aspects and equity-centered aspects in terms of compassion, but also just the fact that you acknowledge that you have children and dogs, and that, you know, this is like the reality that we're living in. So I appreciate you you sharing that as well, and really excited. I know you've shared a couple of resources for folks on the call today that we'll be sharing, that are resources developed by different teams at UBC that relate to some of the things that you were mentioning there. So really looking forward to being able to dig into those, and very much appreciated that you took the time today to be with us. Thank you. And then our final panelist is going to be Tara Black, who I'm just trying to move the slides here. Tara, I've had the privilege of working with for many, many years. I think it's before I even came to SFU, we were working together. And now it's just been incredible to see how Tara has now been able to take all of her skills and knowledge into a different area that's also very related. And I'd love to here in terms of how this is all working out and relating to your work that you established so much of it at SFU, along with Elisa and Rosie, who unfortunately couldn't be here today. And I'm just going to see if I can move the slide up. For some reason, there we go. So Tara now is the Director of People Development at SFU, and would love for you to share a little bit more about your role, how it relates, and then again, back to that question around what can we do now in the context of COVID?
Yeah, definitely. Hi, thank you, Paula, and hello to everybody on the call. Yeah, my role, although I was previously more directly connected with health promotion work at SFU, my role now is more indirectly connected with health promotion work. So I work in people development and with a focus on leadership development. So my work is about developing and coordinating programs that support learning and development and leadership development among staff and staff leaders at the university. There are three components to my work. One is the area of staff development and really helping promote staff capacity building so that people can succeed in their jobs and advance in their careers. Secondly, to inspire and support outstanding leadership at SFU. Up until recently, we really had zero leadership development. So this is new and exciting to have launched. And then lastly, my work is about creating a learning and leadership culture at SFU. So how do those connect to the Healthy Campus systems approach or health promoting universities? Well, I think for the sake of just the short time I've got today, I'm going to focus on leadership development at the university, because I think leaders are a critical part of the organizational system that influences the health and well-being of the system and of individuals and teams. People who lead teams have, I think, the most important impact on the health, well-being, and engagement of the people on their teams. So managers just have this huge influence on people's lives. And, I see leadership as a real privilege. And the influence that they can have is either positive, which is fantastic, but it can also be negative. That's the reality. And so in terms of the areas for action that Paula shared earlier, really my work is about creating supportive workplace environments most directly. And I think leadership is more important now than it ever has been because of COVID and all of the uncertainty, all of the stress and anxiety and everything that we all know is going on right now. So I'm going to ask you to write in the chat in a second. If you can bring to mind an example of an exceptional supervisor, manager, leader that you've had at some point in your life career, who has positively impacted you. And what I'm wondering about is, what was it about them that made them an exceptional leader for you? Like, what are some of the qualities or characteristics? So just feel free to write your answer to that in the chat. So, what was it about them that really impacted you, created a positive team environment? Empathy, living up to their values, curiosity, empathy again, critical thinking, active listening, ability to empathize, relatable. Yeah, thank you so much. Kindness. Keep them coming. Just, yeah, please keep them coming. That's great. Flexibility, mentorship, prioritization of family and health, vulnerability, trust, flexibility again. That's great. I think the impact that leaders have on employee well-being is direct and indirect, and I sort of think of them as upstream and downstream. Some of the upstream ways that leaders impact people and teams is around culture. Creating a positive culture. They create trust in a team environment. They set the tone for a team. They foster collaboration or not. They give people autonomy. We know that people need autonomy for their own well-being. They coach people to help help people come up with their own solutions to problems. They have your back. If something goes wrong, they've got your back, and they make all people feel included. They help develop people. They're thinking about people as whole people, and how people might want to advance in their career, what people need, and they really try and empower people and encourage people to pursue their interests and career aspirations and that kind of thing. All of that together creates a healthier workplace or a healthy workplace community. But the other part of that upstream is also the leader's ability to impact innovation and spark positive change. They are a critical part of the organization to advance work on policies, on broad initiatives that are going to have big, broad impacts on health and well-being. But then on a more downstream, in a more downstream lens, I guess, when leaders are well connected, have positive, trusting relationships with their people, and as Crystal was talking about, have that, mental health literacy and have that understanding of, what impacts health and well-being of people, they're going to be more likely to ask questions and notice when something's not right. And hopefully, that relationship will contribute to somebody being able to reach out for help earlier than they otherwise may have. So there are many examples of really positive and outstanding leaders, but I will say leadership development is a lifelong journey, and leaders need training and support to lead in a positive way. It doesn't matter what level you are in the organization, this applies. It's a journey, and I think we all need to be thinking about this on an ongoing basis. So just some specific things that we're doing. We're offering a comprehensive leadership development for leaders. This program provides leaders with skills, competencies, capacities to lead healthy teams. This is about having leaders look inward, really thinking about how, and being self-reflective, like how am I showing up as a leader? What impact am I having on my team, on my people, on my colleagues and peers in the organization? But it's also about acquiring strong skills for leading people and leading teams, and also about leading in the organization. So we designed our leadership programs to be cohort based, and that was very intentional because we were finding that leaders were feeling very isolated in the work that they're doing. They're sort of thrown off the deep end and may or may not have a network. And so it's been really positive that we've been able to connect leaders from across the organization. And that does a number of things, one being social connection, but also it helps with innovation. It helps move ideas and change forward because people now have connections from a vast number of departments from across the organization. And they're learning and hearing different perspectives on an issue. We're also training on key competencies. Crystal mentioned some of these as well. So things like equity, diversity, and inclusion, Indigenous cultural safety, mental health literacy and psychological safety, coaching, communication skills, conflict resolution skills. And this doesn't apply just to leaders. This is actually for all employees. And we've been trying to, just in the spirit of creating a culture of leadership, we've been really trying to feature positive examples of strong leaders. So we've been interviewing them and asking for their perspective and then sharing that back with the community. And then underpinning all of our learning and development work is, I think, a real tie to health promotion. It's we have a set of principles that we've articulated that really underpin all of everything I do, and it's things like fostering a growth mindset, focusing on strengths, creating an environment where it's safe to take risks and learn from our mistakes, and these kinds of things. Shifting to what can we be doing now in this time of COVID, when I was thinking about leaders specifically, unquestionably it's checking in with your people one-on-one, really understanding everybody's unique situation. I think it just can't be said enough how extremely different individuals' experiences have been of this pandemic. Whether you have kids, whether you're living alone, you're a caregiver, you have elderly parents. Like it's very different, and so leaders need to be checking in with their people and also being flexible in how they're leading people, how they're managing. And then, of course, it's the oxygen mask analogy. It's that taking care of self first and really making that a priority, echoing Crystal and the others as well. And then lastly, I just wanted to mention, so most learning in a workplace context happens informally and not through taking professional development but rather just from everyday work and interactions and problem solving and operations and this kind of thing. What an opportunity for leadership and learning, leadership development and learning these past 5 months have provided, with the change, with the uncertainty, the need to pivot on a dime. And I would encourage people to be reflecting on their leadership over the past 5 months. What have you done to positively impact the health and well-being of your team, of your work community, maybe other communities? What have you learned about yourself along the way? What strengths and opportunities has the pandemic highlighted for you? And what might you want to do differently as we move into the fall and, what might be a second wave? So that's my last little words of wisdom. Back to you, Paula.
Thank you so much, Tara. I really appreciated that. And I think that, you really nailed it in terms of like, this is something that we can all be practicing. It's not about being a leader in a certain position. And so I really appreciate that, because everybody has something to contribute to creating a healthy campus. And especially now in times of this pandemic, we all have a lot to learn. We're all kind of, this is all a huge social experiment, and we're definitely going to be trying out things that are not going to work. And so I think it's like being caring for yourself, and having compassion, and also being really mindful that, you know, what other people's circumstances are, we have absolutely no idea sometimes. And it reminded me, all of this conversation, like, but going back to like the core definition of health promotion, which is really about how do we enable others to increase control over the conditions that are impacting their health. And in this time of the pandemic, there is no control. I mean, things are changing every day, and sometimes quite dramatically for people. So, you know, I think it's very important that we have this conversation, that we also do what we can to do better in whatever roles we are in. I wanted to just highlight that we've put together a list of resources for you that are there for you. We're going to be sharing the slides with all of the participants today. So I just wanted to mention that these are some of the things that we've put together that we think are relevant to the conversation that we've had today. I would like now to make sure that we have at least the last 10 minutes. I'm sorry that it did get shorter and shorter as we went along, but I'd love to open it up to the participants to see if they have questions for the panelists or myself in these last 10 minutes before we close the session. So if people could raise their hands, and Juna, can you help with moderation? I don't want to get out of this slide because I'm afraid I'm going to lose it. Can you see the participants?
Yeah.
Okay, great. Thank you. If there's anybody that has any comments or questions, anything from that resonated with you or didn't. More questions back to our fabulous panelists. Alisa, I see that you raised your hand. Very nice to see you.
Thank you. It's nice to see you as well. I'll lower my hand there. I had a question that anyone really from the panel can answer, but I'm really interested also to hear what Crystal and your work at UBC has entailed. I am finishing my master's right now and using the Mental Health Commission's report and their strategies with the current surveys that they've been administering that looks at the 13 factors. And in your experience, are you implementing the standard fully at UBC, or are there parts of the standard that you're implementing, and how is that going?
Yeah, so essentially it's been a bit tricky for us because we already had a lot of work that was already rolling out when the standards were introduced. So it's almost like we're working backwards, doing mapping and aligning the work and the projects and the different efforts that are already underway with the standards to ensure that we're meeting them. So although we haven't formally adopted them like some of the other Canadian organizations, again, they're foundational, and we really are using them as a framework in the work that we do. So I guess my response would be, although we haven't formally adopted them in the way that the standards kind of depict that you should adopt them, we're actively using them, and we've done mapping to ensure that we are aligning with the standards as well. Does that answer your question?
Yeah, it does. Within the research I've been doing, I've looked at organizations who have implemented the standard and what they're experiencing afterwards, and was wondering, to our extent at the university so large, is it possible? What would that look like? And it would be a long process from just what I was looking into.
Absolutely. I think it is, it's like any health promotion undertaking that's focused on structural change. I think it's a long-term process that we have to continue to work towards. I really like the idea of a journey, particularly when you're in such a large and diverse and complex organization. But yeah, it's still very, very important work to do. And I think it's been really helpful for us. And the folks that we've been working with have found it really, really useful.
Thank you, Crystal. Any other questions or comments from our participants?
Oh, we have one here from Paula. What is the level of your most powerful champion?
What is the level
of your most powerful champion?
I'm not exactly sure I know what the question is, but
I can take a stab at that one. I think, although it was a number of years ago now, we did have our president sign on to the Okanagan Charter. So we did have presidential level support a number of years ago. I am coming from HR, and we certainly are Associate Vice President of Human Resources and our Vice President of Finance and Administration are both extremely on board and supportive, especially on the leadership development side of things. And also our Associate Vice President HR is leading the way on rolling out a mental health strategy for staff and faculty. So it's early days, but there is that level of support for sure.
Yeah, and I'll add to that. I think that I recall when we were doing the 2017 chapter, that every college and university that we were speaking to, everybody was using a different approach in terms of identifying the champions and working with them. But I think a lot of it in the end resulted in like who's actually resourcing some of that change, right? So actually putting money in the budget line to actually make that happen. I think that that speaks volumes in terms of like actually being able to implement and then evaluating the efficacy of those efforts.
Yeah, just to add on, I think for us as well, I mean, we were fortunate enough to have an extremely outspoken, very supportive president, Dr. Santa Ono. He's a real advocate for mental health for students, staff, and faculty, and speaks often about or sharing his own personal anecdotes and experiences with mental health challenges as well. And I think that's been really instrumental, as well as having some of those senior leaders as well at the VP level, but also on the academic side, like really having faculty and dean support has been, I think, really critical in moving action forward. I'm just thinking specifically about this pilot that we are currently involved in, and having that level of support. People do look to leaders to see how they're embodying or modeling, whether they're participating and attending events where folks are exchanging ideas or having dialogue. So I feel like that is really critical.
Thank you, Crystal and Tara. Are there any other questions? I think we have time for one more. Okay. So I think that there are no more comments and questions. I think that I would like to extend my thank you to all of the participants who took their time to be in this conversation. And as I mentioned earlier, I do think that it's something that is part of our ongoing learning as leaders, as faculty, as staff on campus. And I hope that the conversation continues and that we, I guess, learn from all of the comments that were said today. Just really want to appreciate all the panelists and all of your different perspectives and views on this, and hope take some of those challenges and really work towards creating a culture, an institution, strategies, and policies that actually promote this culture of well-being in, in an environment that traditionally is tough and is competitive. And, we have found in our work that we've done, sometimes not very easy to move forward. And so I think having the champions, having that high level support from the presidents all the way down, and I would say particularly having students continuing to advocate and organize themselves, I think is all really important. It'll be a really interesting time to be able to look back and see how we've done and how we've met the different needs of different sub populations here on campus. And with that, I just wanted to extend gratitude to our 4 panelists, so Tara, Angelica, Yuna, and Crystal, for again making the time, sharing your expertise, your experience, your learnings here. It is very appreciated, and I know that there are a lot of really rich resources out there that hoping that we can use those to continue learning and continue improving the well-being and health outcomes for all of us on campus. So with that, I will close and say thank you very much.
Thank you. Take care.
Yuna, can I ask you to stop the recording, please, when you can?